As coaches, therapists, and helpers, most of us entered this work for the same reason. We want to reduce suffering and help people live more meaningful lives. We care deeply about the people we serve. And because we care, we often use language intended to be compassionate, validating, and supportive. We might say, process your emotions, regulate yourself, validate the feeling, sit with the emotion, heal your inner child. That's your attachment style. I was traumatized. I feel traumatized. Or even, I feel strongly that this is true. Before we go any further, I want to be clear about something. This video is not a criticism of therapists, coaches, counselors, or the approaches from which these phrases emerge. In fact, I believe most of these expressions became popular because they point towards something genuinely important and helpful. Nor am I suggesting that these concepts are wrong, useless, or should be abandoned. My concern is that sometimes the language we use can become so broad, abstract, or ambiguous that people are left wondering what it actually means or what they are supposed to do next. As helpers, we share the value of compassion. We want people to feel understood rather than judged. We want to reduce shame rather than increase it. We want people to feel seen, heard, and accepted. The question I want to explore is whether we can combine that compassion with greater precision. Can we keep the heart of these ideas while making them more concrete, practical, and actionable? Because when compassion and clarity work together, people often gain not only understanding, but also a clearer path forward. Let's start with a common phrase: process your emotions. Most of us know there is something valuable behind that phrase. But what does it actually mean? Does it mean naming the emotion? Understanding what triggered it? Noticing what thoughts are contributing to it? Paying attention to bodily sensations? Discussing it with someone? Taking a small action consistent with our values? Those are all different activities. When we become more specific, the phrase becomes more useful. The same is true of self-regulation. What does that mean? Breathing slowly, grounding in the present moment, reducing emotional intensity before responding, choosing a thoughtful action rather than reacting impulsively. Again, precision helps people know what to do. Consider the phrase, validate the emotion. Validation does not necessarily mean that every conclusion associated with the emotion is accurate. It may simply mean, given your experience, it makes sense that this feeling showed up. The feeling is understandable. Then we can explore whether the conclusions, predictions, or assumptions attached to that feeling are helpful or accurate. Or take the phrase, sit with the emotion. Many clients hear this and wonder what they are supposed to do. Often what we mean is, don't immediately run from it. Don't numb it. Don't attack someone because of it. Don't automatically obey it. Instead, notice it, name it, make room for it, and allow it to be present long enough to learn from it. Another phrase that has become increasingly common is, heal your inner child. Again, there is often something important beneath the phrase. Perhaps we are talking about old wounds, unmet needs, painful experiences, protective rules learned long ago, or ways we learn to view ourselves and others. But when we simply tell someone to heal their inner child, they may not know what that actually involves. What specific memories? What specific beliefs? What specific skills? What specific actions? The more concrete we become, the more helpful the concept becomes. Now consider a phrase we hear frequently today: I was traumatized, or I feel traumatized. Sometimes that description is absolutely accurate. At other times, it may be pointing towards several different experiences. Does the person mean they experienced a life-threatening event? Do they have intrusive memories? Do they feel unsafe? Were they betrayed? Are they grieving? Do they feel ashamed? Do they feel overwhelmed? These experiences matter, but they are not identical. The label may be a starting point, but understanding the specific experience helps guide what comes next. Another area where precision matters is the relationship between feelings and truth. Someone might say, I feel strongly that my partner doesn't care about me. Or, I feel like something terrible is going to happen. The feeling is real. The emotional experience deserves attention. But the feeling itself does not automatically establish the accuracy of the conclusion. Fear does not necessarily mean danger. Jealousy does not necessarily mean betrayal. Anxiety does not necessarily mean catastrophe. Confidence does not necessarily mean correctness. One of the most important skills we can help people develop is learning to distinguish between two questions. What am I feeling? And what evidence supports the conclusion I am drawing? Both questions matter. Neither should replace the other. Even concepts like attachment styles can become more useful when translated into concrete experiences. Instead of saying, that's just your attachment style, we might ask, what did you learn about relationships growing up? What rules did you develop about trust, closeness, conflict, or vulnerability? What experiences shape those rules? And what small step might help you move toward the kind of relationship you want today? That conversation often creates more flexibility and hope than a label alone. The common thread in all of these examples is not that compassion and validation are wrong. Quite the opposite. These phrases became popular because they point towards something valuable. The challenge is that compassion without clarity can leave people uncertain about what to do next. And clarity without compassion can leave people feeling unseen. What many of us are striving for is the integration of both, compassion and precision, validation and understanding, acceptance and action. As therapists, coaches, and helpers, we are all learning. We are all refining our language. We are all trying to find better ways to translate complex human experiences into words that are both caring and useful. Perhaps a helpful question for all of us is this: when I use a therapeutic phrase, would the person I'm helping know exactly what I mean and what they can do with it? Because clarity is not the enemy of compassion. In many cases, clarity is one of the most compassionate things we can offer. Thank you for watching. If you found this discussion helpful, please consider liking the video, subscribing to the channel, and sharing your thoughts in the comments. What therapy or coaching phrase do you think is helpful but could benefit from greater clarity?